Hello, my name is Dr. Nandita Rai and I'm a cosmetic dermatologist, and we have our clinic in Siliguri, Champasari More, Pradhan Nagar Road, Neo Skin Clinic. Yeah, that's our clinic, and we deal with lots of treatments, clinical as well as non-clinical. We have facilities for hair removal, for mole and tag removal, for wart removal, for we have treatments for freckles, pigmentation. We have lasers, we have PRP, and so we have a lot of options for hair treatment, skincare treatment. We have acne treatment. We deal with acne treatment with chemical peels, lasers, and we have other modern techniques like scar treatment, fat graft treatment, PRP, and a lot of other like subcision, etc. So we deal with mostly surgical as well as not surgical and cosmetic treatments like fillers, botox, PRP. So we have this clinic situated in Satyajit Roy Market, Champasari, and it's called New Skin Clinic, and it's run by my partner Pushka, my husband, and me. We are both running this clinic, and we have facilities for skin, hair care, and we treat clinically as well as cosmetically. And a lot of patients are coming right now with this COVID situation, and it's very difficult because for doctors like dermatologist and a lot of other doctors, we are facing a lot of problems handling the patients post COVID and also with COVID, because there are a lot of skin infections coming with with this pandemic situation, a lot of hair problem. So right now I'm just waving hi to everybody who are joining, and I'm very thankful that you are making time to join my live chat show. You can ask me questions. If you have any questions, I can reply them. Definitely I will try to discuss more and more cases which I'm seeing during this pandemic situation. So as usual, we all come across as a dermatologist, we come across fungal infections. So that is common since long ages. So fungal infections are there. There are lot of infections like herpes, and right now I'm seeing a lot of cases with hair fall, like hair fall issues are there. And people with all kind of ages are coming, like 18, 19. They are starting from 18 years old. I'm very surprised that 18 years old are also suffering from hair loss, and even people who are in their mid 20s, they are suffering hair loss. Like I'm treating patients who are 25, 26, whereas in that age, I think so we don't lose hair much, but I'm seeing a lot of guys and girls are going bald. They are having alopecia areata, that is called patches, on different parts of the head. And so a lot of teenagers, like around the age of 12, 13, and also adult, like around the age of 30s and in the mid 20s, they're suffering from acne. So it's very, very common right now where people are suffering from hair fall, acne, fungal infections. And definitely it is very difficult for patients who are suffering from psoriasis since their childhood, since their early teens or after teens. There is a big problem for this kind of patient because they suffer from a lot of anxiety, depression. They have every time they have to manage the skin, and there are people who are also suffering from vitiligo, but they are very much hesitant to come out and get the treatment because they are fed up of getting the treatment because it's not curable. Psoriasis, eczema, uh, uh, like cases like vitiligo, these are uncurable and not curable, but they are treatable. Definitely modern medicine and science and the field of cosmetology has made possible for us to at least treat these diseases and keep them in certain remission time, and so that patients feel comfortable on their own skin. We have eczema lasers to treat psoriasis, vitiligo, and eczema, and we have medications. They need to follow up doctors, they're respectable doctors, and they need to do a lot of lab tests, including sugar, blood sugar, diabetes, because they are very much in risk of getting diabetes, hypertension, cardiac problem, weight gain, all this kind of diseases comes with the skin problems, chronic skin problems. So definitely people with chronic skin problems, they suffer from anxiety, depression, low self-esteem, especially lower self-esteem, and they come with a lot of complaints, unsatisfactory treatment, so they start quitting the medicines, and they don't have much belief in modern medicine. They go for other treatment options like this Ayurveda, homeopathy, and these are the kind of treatment which can give you psychological balance and some kind of physical support, mental support, but they are not treatable, they are not curable by Ayurvedic and homeopathic medicines. But definitely it supports your mental and physical well-being, because it is kind of supportive therapy, I might say. And it is definitely supportive therapy. But in the long run, you need to treat your eczema, psoriasis, vitiligo, and other chronic diseases, skin diseases, with dermatologist, and you need to actually get always good counseling first about your anxiety, depression, mental health. Because whenever I say people that when you have skin problem, definitely you have low self-esteem, and you are unsatisfied with any treatment, you do a lot of doctor shopping, you have gone from one doctor to another doctor to third doctor and many other doctors, and you have wasted around 10,000 20,000 rupees in the treatment because you are not satisfied. And that time I tell patients to get mental health support, and which is very important, but patients don't understand, and they start giving me negative attitude, stating that I don't have any mental illness, and you are just suggesting me wrong things. Why should I go to a psychiatrist or psychologist? But I'll tell my patients one thing, that it is very very important for patients with skin disorder to visit mental health counselor, psychiatrist, psychologist, and share your anxiety, depression, and low self-esteem, because you end up wasting a lot of money, and that's not my problem. But of course, for your well-being, I'm just discussing this thing today on my live show, that it's not my problem that you waste crores of rupees on whatever whatsoever. But when you get some kind of disease in your body, it is somatopsycho, automatically you get somatopsychosis. That is, physical well-being is not good, and suddenly you get into low self-esteem, depression, and anxiety. So that's why you have to visit a psychiatrist, a good psychologist, to counsel you. If you're visiting a lot of doctors in a year, around, I've seen patients visiting like 10 to 5 to 10 doctors in a year, and with the same skin treatment. For example, a patient came to me with sagging. She was 45 years old, and definitely in that age we all women experience hormonal imbalance, sagging, wrinkles, and she was constantly going to different doctors for botox and fillers and a lot of other treatment options. Right now we have a lot of treatment options like PRP, hydrofacial, lasers, and she ended up coming to me, and she was quite depressed with the look she got from different doctors, because they did not refer her to any psychiatrist, they did not refer her to any counselor, psychologist. And she was really having bad skin condition. She was suffering from acne eruptions in the age of 45. Her skin was not looking that good, and she was even not mentally stable. Actually, while speaking to her, I can see that she had a lot of embarrassment and a lot of anger in her, and I definitely counseled her to go to a good psychiatrist, counselor, psychologist. And then after getting good counseling, she can come to me and I can treat her according to her age, because certain age whenever you do any treatment, it takes time. And if you're suffering from other ailments like psychiatric problem, or maybe some kind of thyroid hormonal problems, or diabetes, or you have family history of thyroid problems, diabetes, cardiac problems, then you should definitely look into that root cause and then go further with the beauty treatments, which are definitely, it's not bad to do, because cosmetic treatment nowadays is very good option to keep your anti-age problems on at the bay. And you get definitely benefited by this cosmetic treatment, but to overdo is, it's very bad problem. And during this pandemic situation, a lot of women are suffering from identity problems, self identity problems, low self esteem. And I'm seeing a lot of a lot of girls above 25, they actually are suffering from acne, hair fall, hormonal imbalances, PCOS, that is polycystic ovarian syndrome, and they lack exercise, but they're doing extreme dieting. They just don't eat anything, just bread, butter, I don't know what else they're eating, but they just tell me surprising things like, I'm eating collagen powder. I don't know what the hell it is. I don't think so it is working, but the marketing of the collagen powder is quite good in all over northeast part of India, I think, and which is of no benefit. I'll tell you, you have to eat good proper diet. You have to maintain with exercise and meditation your good health, and then you can get good body, and you can get good skin. So definitely diet, lifestyle, and your mental well-being is one of the factor that will keep you fit, and also it will give you results. And whatever it is, cosmetic treatment is just cosmetic treatment, and definitely to give you good look and good personality. But besides that, you have to keep good lifestyle, good mental health being. That's what I'm actually telling you today in this live chat show. Definitely I have challenges, lot of challenges while facing the patients, because first of all, I don't get there in India. Actually, I don't get any kind of documentation from patients. They just tell me the name of random doctors and the way they treated them, but they never produce me any kind of documentation, no prescription, no medication history. I don't know, there is no proof that they took those medication, but they just randomly come and talk about those doctors and treatment, and they actually follow up only once with me, and then they get vanished. So this is not good. Actually, dear patients, I just tell you, this is not good habit of randomly coming to the clinic, and you want better treatment options, and then you don't have any documentation. There's no proof that you took those kind of treatments, and then suddenly when I give you treatment, you vanish in the middle of the treatment, and I don't have any kind of documentation that you are going through good medication or not, are you getting good treatment or not. So this is very bad system in India, that where we cannot keep track of patients, and we don't know what happened to that patient at last, and consecutively, and eventually the doctors get the blame, and we are the victim, and we get the blame, and we are abused later on. So this is the one part that patients should understand, that getting educated from a proper doctor is necessary, and doctors should also, of course, counsel the patient very well, especially in derma department, where the skin is very important part of our body, is the first protective and the largest organ of our body, and it shows your health. Skin shows definitely your physical health, your mental health, it shows on your skin. So these are the things. So lot of times, I'm just like I told before, that hair fall is the main issue. Why hair fall, why acne, why fungal, why this kind of other skin problems are coming up in pandemic situation? It is definitely lockdown, and also this kind of immunity loss is there in patients. I'm seeing that patients have lost their good healthy lifestyle, their proper way of eating and exercise, the way they used to maintain their lifestyle. This has been little bit lacking in the pandemic situation, and that's why a lot of hormonal challenges are coming, like thyroid problems, weight gain, weight loss, extreme weight gain or extreme weight loss. There's no such kind of thing where the patients are keeping their weight constant. And I don't know, now these modern techniques are coming where you go to gym and do extreme diet, and then later when you gain that target you are quitting everything and again you go back to your old self. So these are the things which patient must understand, that once you do you start hitting the gym and you do certain kind of practice of diet and all the maintenance, it should be long life, like it should be lifelong. And you should actually maintain that. And that's why it comes, like all this kind of lifestyle, it goes through towards the systemic diseases like diabetes, cardiac problem, fatty liver, weight gain, or extreme weight loss, and due to which you definitely will get fungal infections, bacterial infections, and hair loss problems because of hormonal issues, and definitely acne problems. Even if you are reaching your 40s, some people are getting acne, and other things which I'm getting is like pigmentation problem, pigmentation in small children actually. So a lot of children who are actually, okay, so that's okay. So I'm getting a lot of children, some of the children are in the age group between 10 to 12, 13, 14, like that age group, teenage, in their puberty age. They are having weight gain, and they're getting all those kind of pigmentation around their neck, on their under their armpits, in between their thighs, and a lot of other parts of the body they're getting pigmentation, which is known as acanthosis nigerians. And this kind of children are really obese, and they have this kind of issue, and these children are not actually playing outside, they are not into physical fitness, they are just into online classes, and that's it, and they eat whatever they're getting 24 hours in a house, and they don't have any kind of playing attitude. So right now in this pandemic situation, I'm seeing a lot of school going children, actually they are facing pigmentation problem. And of course pigmentation problem comes in any age, even in teenage or maybe in the adulthood. So there are a lot of kinds of pigmentation. Some of the pigmentation are really chronic skin disorders, like blindness, Hailey disease. A lot of other diseases are there that we have to differentiate. And so these are the problems which are getting from the patients. And patients are really having anxiety issues, depression, low self-esteem. So this must be treated. And definitely we have treatment for pigmentation, especially for melasma. Melasma is a pregnancy mask. It comes pre-pregnancy or post-pregnancy, and also if you use a lot of hormonal pills, contraceptives, so you get this melasma. And other differential diagnosis of melasma is freckles. Freckles comes from extreme exposure to sunlight. So if you don't wear sunscreen and you are constantly exposing yourself towards the sunlight without any protection, then definitely you get this freckle problems. So there are options like sunscreen, wearing good covered clothes, hat, sunglasses, to prevent this kind of melasma and freckles. And also there are laser treatments in my clinic, so you can always take appointment and come for laser treatment, for PRP treatment, that is platelet rich plasma treatment, which is very common in my clinic. And a lot of patients are very satisfied with it, because they get the benefit from their own blood, where plasma is derived from their own blood, from whole blood, and they inject it into the skin and hair for hair loss problem, for pigmentation, for sagging, for wrinkles. And definitely this helps a lot in other parts of the body also. And these treatments are available in my clinic. Whereas even when it concern about like a lot of them are asking me about fillers and botox, definitely we do that. But randomly you cannot come and get on the spot fillers and botox and PRP treatment, because you need to be counseled, you need to understand what is the treatment, how it goes, because each doctor, they have their own art, they are like artists, and they have their own art and they have their own protocols they follow in their clinic or hospitals. So my protocol is I go through the patient, I conceal the patient, I conceal them, I look through their skin or hair and I examine them, and then I decide whether the patient can undergo the treatment or not, because it's very very important to know the patient and to get the trust from the patient. So trust should be earned by both parties, even the doctor and the patient both should earn the trust, and therefore the counseling part is very necessary for any kind of cosmetic treatment in my clinic, because we need to gain trust, we need to know the procedure, we need to have knowledge how the treatment will go on, how long the treatment will stay, and how the maintenance should be done, and how you can protect your skin, hair, body. It should be always understood between me and my patient, and all the rules of COVID should be followed, because second thing is the first thing is this, second thing is we have to follow the protocol which is been declared by all over the world, by WHO, by health organization, by health department and ministry, that we must still follow the protocol, that is mask and social distancing and sanitizing, and avoiding all kind of infectious situation. So this must be followed in COVID era, because still this COVID-19 virus is still there, and it will still be there, because a lot of people have started traveling and getting the crowd attention, this kind, because we are very impatient people, so we like to go in crowd, we like to have party, we like to do a lot of social things, because we are social animal. But I think so because of this, now another wave is going to come, and definitely it will hit us harder. So therefore we have to maintain all these kind of protocols. I request all the patients, whenever you come to clinic, just maintain distance, wear mask. In my clinic shoes are not allowed, and you need to sanitize yourself whenever you come inside the clinic, and you need to have consultation, proper consultation, if you want to do some kind of cosmetic treatment, and you have to go through some kind of lab test, which if it is required we advise our patients, and you must follow that. So it's a matter of health, and it's a matter of your benefit and my benefit, and it's a matter of understanding and trusting each other. So these are the situations which I am facing right now in my clinic, and I am trying to explain my patients, and sometimes it's very good to explain on this platform, social media. Therefore I took out this opportunity to interact with my patients, but none of my patients or any of has joined, because maybe they are like too busy, or I think so they don't like to hear this kind of suggestions. But anyway, I'm recording this video and I'll be posting it so that you can listen to it and you can ask me questions. So if any kind of question arises regarding your hair loss, regarding your acne, or any kind of cosmetic treatment, just don't call me and just tell I want some cream, doctor, I want some lotion, I want this cure. I'll tell you, talking on the phone and getting the prescription is not a treatment. It's called saying hi to doctor. It's just like greetings. It's not proper way, it's not professional. It's not professional to talk on the phone and suggesting you cream. It's like I'm talking about Oriflame or maybe L'Oreal or some kind of Paris items. I'm not a marketer of those kind of cosmetics, and I don't market any kind of cosmetics. I am not a seller of cream, or I'm not a seller of shampoo. I don't have any endorsement, and neither this company pays me. I am doing selfless duty as a doctor, and nobody pays me to suggest you all this thing and to give you good treatment and to see my patients in good health. Nobody is paying me, and nobody is actually telling me to do marketing of this kind of stuff. So better, if you want some treatment, proper treatment of your skin and your health, and you want to look good, you want to have a good skin, healthy life and healthy body, then you must take appointment. You should come to my clinic. It's located in Champasari, Pradhan Nagar Road, Siliguri, and you can always consult online, where you can talk to me directly in a proper process, in a proper appointment way, and then you can get proper treatment with full PDF format prescription, and you can use that prescription all over India, because it will be a proper legal prescription that I'll be prescribing you with online consultation. So online consultation is the proper way, where you take appointment, you fix the date, then after fixing the date, you do all the process which has been explained to you, and then you get the prescription. So this is the proper way of talking to a doctor, and proper way of dealing with any human being on the earth, because if you go to any shop, you just don't pick up the thing and you get out of that market. You go, you talk to the cashier, you talk with a lot of people who are selling things, and then you do the things. It's done always in the proper way. But doctor is not a supermarket. Doctor is a noble person who is treating you without any selflessness, so without any selfishness. We are doing thankless job, so please respect that. And I request everybody, if I have hurt you by any kind of this kind of statement, I'm sorry, but it's the truth. In India, we are hurting doctors more than treating them right. We are human beings, and it's a doctors month, doctors day month. That's why I'm trying to raise my voice. Violence and harassment which doctors, especially lady doctors, are also facing in India, with a lot of inequality, lot of sexism remarks, and a lot of harassment, and women are not respecting women. That is also another thing. So we must try to put each other's crown on our heads as women to women. And this is a simple request from a simple person like me. Before being a doctor, I'm a human being, and we should respect each other as a human being. And regardless of any profession, we must respect each other. And while you take appointment, don't harass my staff, don't harass my colleagues or my partner by talking rudely. Maybe we make mistakes, we are human beings, we make mistakes, but I think so you should consider that. And whenever you call me, just don't tell doctor, I want cream, I want this, I want that. Don't demand. I'm not restaurant fast food seller, or maybe I'm not Zomato or Swiggy. I am a doctor, and if you want consultation, you want good treatment, you must take appointment and approach me in a proper manner. There's a process, and we must follow all the COVID-19 protocol, and we have to go through that process too. So let's save India, let's save doctors, and let's save good human beings on this planet, and be good to each other. And these are the challenges which I face actually in my clinic, and dermatological challenges. And definitely don't feel bad about yourself, because you all are beautiful people. And whenever a doctor suggests you to take mental health option, it is not a bad thing. Even we doctors, we take mental health advice from psychiatrists and psychologists, because we go through a lot while dealing with patients, while going through our lives, while maintaining duty hours, and also our family life. So we have to, in this kind of situation, each and every profession, whether it's actor, actress, or big businessman, or minister of India, or prime minister, they need to have a good mental health solution, because we need to deal with life right now in a very critical condition. That's why these are the suggestions which I give to my patients. And if any questions, my dear patients, or my dear friends, or my colleagues, or my family members who have joined here, if you have any questions, you can inbox me, or you can ask me anyway. I'll be ready to help you. And I hope we will always cherish each other, we'll always respect each other. That's the only thing which will keep our world alive in peace, health, and happiness. And I hope my things are clear right now. If any problem, appointment, you can take appointment by calling 70700000787, and you can even WhatsApp in this number, and you can even inbox me at dr.nance, and follow me on my page on Facebook, Neo Skin Clinic, or Dr. Nance Skin Clinic. So you can approach me anytime. I'll be ready to help, but please approach in a proper way. Let's respect each other, let's follow the protocol, and avoid the crowd and parties. Everything will be there. Nothing is going to go away from our life. Everything will come, but let's make that those beautiful things come on our way by staying great, having good lifestyle, good health, and eating good and in a proper way, and following great lifestyle. That's what I want to say, and that's it. So have a great Sunday, and thank you for joining. If any question, you can always inbox me. And I thank everybody who has joined, and whoever are unable to see this, I'm going to send a video on YouTube and Facebook, so you can see it and question me your skin problems, and I'll be ready to answer them. Thank you so much. Have a great Sunday.